Ma'am is also running Malti Test Tube Baby Center at Bhopal. These all are our lovely senior faculties, and we are happy to have her as our chairperson in this first session. And lastly, I will like to invite Dr. Vijaya Lakshmi ma'am from Vijaya Maternity Hospital, Bhopal. She is also a senior gynecologist with more than 25 years of experience in high-risk management and infertility management. All faculty, all chairpersons are having a warm welcome. I would like them to take over the session now. Mic नहीं चल रहा.
Hello everybody and good afternoon. I'll be introducing the first speaker of the session. She is Professor Dr. Jaideep Malhotra. She is the Managing Director, ART Rainbow IVF Agra. She is President of INSAR. She is past Chair FIGO. She is also past President of Aspire, Foxy, ISAR, IMS. She is recipient of a number of Distinguished Women Awards. And she is also initiator of many activities like Club 35+. Over to you, ma'am, and welcome.
Thank you so much, and a very good afternoon to all of you. I know it's post-lunch session and the lunch has just started, so it's going to be a little challenging for me to keep you awake. But
खाया नहीं है मैडम किसी ने. Everybody is keen to listen to
sorry.
you.
I'm really sorry about this. Okay. So thank you so much for being here, all the chairpersons and also the organizing team and the young beautiful girls who have been really, really pushy and helpful. More power to you. I'm going to talk on perinatal outcomes because my talk was scheduled a little later, but I have a conflicting session in the next hall at the same time. So it's good to start with the perinatal outcomes in fertility after 40 because it's again very important for us to understand that though the times are really changing, and I think there has been a major shift as far as the choice of a pregnancy is concerned in the younger generation, and none of them, especially these young couples, are looking at early pregnancies. So late pregnancies basically have become a very sensitive issue, especially us who are in a little older generation now, and the ones who understand the nuances of fertility after 40, it really becomes a challenge. But I think also what is important for us is to also understand that yes, this is something, a major shift which is coming up, and probably we'll have to find a very I would say a congenial path between the two, which is really important because increasing maternal age, basically, if you see here, initially at least I know that when I got married, I had a set goal in my mind that I will finish my family by the time I reach 30. Today people are not even they're not even getting married at 30. And so the age of marriage and also the age of having children is really increasing. But on the other hand, there's another very important aspect which I would like to say, that our fertility also declines with age. So we have to keep both the things in mind, which are very important. But a lot of people come and discuss with me and say, see, now the government of India has also increased the age of having a child and even IVF till 50 years. So I think I would say that use your mind and say, okay, you can have a baby. Even after 40 also, majority of the women will be having pregnancies with donated eggs. Natural pregnancies are very rare as far as this age group is concerned. So it is something which has to be understood and rationally, decided. Now, the reasons are many, and I really don't blame any one of them because women are getting very highly educated. They want to work, they don't want to compromise on their careers, and I feel sometimes, the men are not as compromising or as supporting, or the families are not as supporting. Sometimes another debate which could probably be there is that we also don't want joint families. I could reach wherever I reached because we lived in a joint family and there was a lot of support in the family itself. So there are a lot of things which have to be thought about, and those are the things which will probably make us, after a few years, reach a conclusion on how we want to lead our life. But one thing is very certain, which I would really like all of us to understand, is that as age advances, there is a decline in all kinds of functions in our body, whether it is, the neuro or nephro system or the urinary or kidney, lung functions, everything declines. But if you will see here, what declines the fastest is the fertility. And the decline is very sharp after 35 years. And I would say we are talking in Indian Menopause Society, and I can tell you our age of menopause is 46.5, and it's much, much lesser than the Western figures, which is about 51 years. So the cutoff of 35 does not hold true for us. Our cutoff is actually 33. So we have to understand and then go ahead and take whatever decisions have to be taken. Now, when we look at the obstetric outcome, as the maternal age advances, what will happen? Our chances of having GDM, our chances of having small for gestational age babies, or miscarriages, or preeclampsia, hypertension, everything increases exponentially. If you can see this graph here. Now, with self eggs or non-donor eggs, if you see here, again the chances of miscarriage are very, very high in this age group, and that's why we should definitely be really thinking about it. Now let's look at all the issues, and I'll start with the early pregnancy issues which are there. As I have already said, that the risk of miscarriages are pretty much high, and we have to understand again why these miscarriages are high. Most of them are because of genetic causes, because if you are looking at the aneuploidy in the oocytes, once you are about 30 years of age, the oocyte aneuploidy is about 40%. By 33 to 35, it is about 50%, and by 40, it's more than 60% or maybe more. So if we are, firstly, we'll never get 10 eggs. Even if you get 10 eggs, more than 60% of them are going to be abnormal. And that is why those will lead to embryos which are abnormal, and that's why miscarriage rate is very, very high, and the chances of pregnancy are much, much lower. Plus, these pregnancies, especially because we are looking at a lot of these chromosomal abnormalities at this age group. So again, if it is a natural pregnancy, because I haven't really defined here natural, we are only dealing with fertility at 40, which could be either. And both ways, whether it's natural or assisted reproductive technology, the end result is almost same. We could probably say, okay, how can we improvise, especially in ART? We can improvise in ART if we look at doing PGTA, only transferring, euploid embryos. Yes, we can reduce these chromosomal abnormalities, but otherwise, on a normal basis, autosomal trisomy is one of the most common factors as far as miscarriages or abnormal pregnancies are concerned, which are basically age related. And that's something which we have to understand. And also what is important here is that it's not only the maternal age. Even the paternal age also contributes to autism and many other spectrum of autism which are there. So we have to understand the risk of miscarriage and the risk of congenital malformations are, why is it jumping, are very, very high. And what is an optimum age where you will have this at the lowest? So that optimum age is between 22 to 32 years of age. So if you complete your family between this age group, then the best perinatal outcomes are going to be there, and that's what we have to understand and also make our patients understand. Now, after the early pregnancy issues, what are the late pregnancy issues which can happen in these patients? Now, a lot of obstetric complications. Now, these obstetric complications can be because of age related, because as age advances, we already have a lot of issues which will come up with aging, whether it's hypertension, diabetes, or obesity is there. And these factors will definitely have an add-on contribution to the obstetric outcome in this age group. And aging alone also, because the blood flows are reduced in all the organs, again can be one of the factors. But along with that, when coexisting factors are there, like multiple pregnancies even naturally in this age group are a little higher than normal this thing. And if you're looking at ART, then of course they will be there. Then high parity and the chronic medical conditions, they superimpose and can lead to a very unfavorable outcome. So all these adverse outcomes which we are really looking at increasing maternal morbidity and severe morbidity, especially as far as, we say, but in our country it doesn't really hold true because our cesarean section rate is as it is very high. But in the Western world, where they don't do cesarean section as easily as us, the cesarean section rate in this age group is much, much higher. Now, what we have to understand is that after one cesarean section, there are many other obstetric complications which are very common in any age group. So, avoidance of that first cesarean section is also very important. Plus, if it is super added with age-related or like a preeclampsia, then postpartum hemorrhage is very common, gestational diabetes is very common, thrombosis, and chances of having a hysterectomy are also very much common. Now, does it really make a difference if the interval between two pregnancies is shorter, could be between 6 months to 18 months? And what has been seen is that in the younger age group, if this interval is shorter, it really doesn't really make much difference, and because the body really adapts. But as you grow older, it could be one of the other issues. Now, it's not only that in the pregnancy people will have hypertension or gestational diabetes. We have to understand that if somebody gets any of these conditions during pregnancy, let's say somebody got gestational diabetes. Now, for her to become a full-fledged diabetic in next 5 years, there's a great chance. So that is something also which we have to understand and take precautions which are important. And similar is true for hypertension also. If preeclampsia is happening or pregnancy-induced hypertension is happening, for her to become a chronic hypertensive, chances are much, much higher to the extent of about maybe 2 to 4-fold. Especially in women who are more than 35 years. So the overall the health is also affected. Now, why I'm telling you all these things is also important, because it's not only important for this woman to have a baby. She has to be healthy enough to nurture that baby to a certain age when the baby is able to take care of herself or himself, which are important. Then secondly, in this age group, the placental problems, the placenta accreta syndrome, what we normally say, placenta previa and accreta, they're all very common. And that's again, the almost about 10-fold increase in the risk of having placenta previa in this age group. And that again can be a huge, very significant and severe obstetric complication. Now, this is a chart which just shows you that what all can happen, and if a person is falling in between 18 to 34 years, and then the second group is 35 to 40, and the third group is more than 40, and if you see here, the chances of gestational diabetes, placenta previa, breech, elective cesarean, now all of them are much, much higher in the over 40 group, and that's a very, very important aspect which we should definitely be considering. Because we say everything is possible. Yes, everything is possible. But we also have to understand the price we are going to pay for that possibility. And if it can be done at a little earlier age or planned at a little earlier age, it will take care of a lot of other issues which I have not I don't think I have the time to explain, but I will still try and explain. Let's say if somebody's gotten gestational diabetes during pregnancy, the chances of having diabetes in the next two generations in the children are going to be much higher. So it's not only the mother who's going to suffer, but the gene expression is going to happen in the future 2 generations. So we have to understand this and see. Now, as far as the perinatal morbidity is concerned, so if we look here, as the age advances, especially in singleton pregnancies, there is a definite increase as far as the age is concerned. But if there are multiple pregnancies, then of course, then most of the times these are really comparable. Now, the risk of having stillbirth, again, much higher in this age group. And again, this could be attributed to many chromosomal anomalies is one, but the blood flows in the uterus again are the next things which we need to consider. Now, what about labor and cesarean section? As we have already understood that the chances of abnormal presentation are much higher, chances of placenta previa are much higher, so obviously the chances of having normal vaginal birth are going to be much lower, and especially nobody takes a chance in this age group also, so cesarean sections are going to be much higher. Also, the super added causes as far as preeclampsia and the other things are concerned, so these are really going to lead to a much higher chance of having a cesarean delivery. And as we really advance again, when we look at the stillbirth rate, so if it is a first-time mother who's going to give birth at an older age, her chances of having stillbirth are much higher. If you see there in the older, 40 years and older, and compare it between 35, 39 and more than 40, the chances of stillbirth are much higher in this age group, and that again needs to be understood and counseled to a woman who ever comes to you in this age group. Now, what about neonatal outcomes? Again, India is the preterm birth capital of the world, and the chances of having preterm birth in India as compared to even China, which has equal number of births, is 3 times higher. We have the same number of births, but in this age group, it is even higher. And preterm, if you understand, I'm just connecting the dots for you, because if somebody is a preterm baby, the chances of that baby having cardiovascular disease are much higher. And today we are not only the preterm birth capital of the world, we are the obesity capital of the world, we are the cardiovascular disease capital of the world. In our country, cardiovascular disease comes much earlier than the West, 10 years earlier than the West. So there are a lot of contributory factors which we have to understand, and if we are able to explain, I think probably we can change the landscape of maternal mortality and neonatal mortality, and plus health status of our country as far as this understanding is really concerned. Now, multiple gestations, again, probability, we all understand the probability of preterm birth is much more, and also the outcomes are also going to be much more. Now, let's understand a little bit about the later issues. Parenting. There has been a lot of debate. Some people say that older the parents are, there's better bonding because they have more time, maybe they are a little more relaxed. And the others say no, they are more insecure because having a baby at a later age can have that insecurity. God forbid if something happens to the baby, I may not have another chance. So this debate, I think we need much larger data on this. Unfortunately, right now I don't have. But the relationship between the child and the parent is quite debatable in this age group. I see it myself at sometimes, when I have grandchildren, I don't feel the same kind of energy. If my daughter leaves them for one day with them, I'm tired after 1 hour. If I'm teaching them also, I lose focus after half an hour. Even they lose, but I also lose focus. So if a parent has to do all that, I don't know how they're going to really do. And I think that's a lot of food for thought, which needs to be understood. Similarly, about the medical problems and life after, now God forbid, if something happens. As I said, like in our country, heart disease comes at 45 plus. If somebody has had a baby at 40, so we have to factor all those things also in place, not only that if it is possible, let us just do it at a later age. And that's something which again is very, very important aspect of counseling which we should be looking at. Now, of course, it is happening every day. And, so once it happens, how do you really manage? Or if somebody comes at that age, I think every other day, there are 3 or 4 couples who are walking in at this age and they're saying that we want to plan a baby. Now, for them, it's very important that all this counseling needs to be done before, if they've come before, optimize all the parameters if they have any chronic diseases. Preconception care is very, very important. Start with all the supplementation and tell them, at least to start exercising and be as fit as possible, which are very important. And once, if early pregnancy happens, then all the screening has to be in place, which are again important, right from dating to the first trimester, 11 to 14 week scan. If we have to do any screening, especially PCOs who are getting pregnant at this age, the sugar, GTT should be done as soon as possible as they come. And I think it's a good idea to start them on low-dose aspirin therapy if it is really indicated. And of course, aneuploidy assessment is very important. And then at a later age, later stage of pregnancy, again, because all the complications are very more common and stillbirths are more common, so monitoring has to be very, very good in these patients, which are very important aspects which should be kept in mind. Now, we don't have time to counsel all this, and neither do we have time to prepare patients in the preconception period. So I like and request all of you to use this wonderful app. I'm the founder of this app. We have about 1.5 million women who are logged on to this app. In this app, we have 3 parts. One is preconception care, where a pregnancy coach, a nutritionist, and a yoga and an instructor works with the couple. A lot of them are diabetic, hypertensive, obese. If they optimize their parameters in the next 3 months and then plan a pregnancy, I think that would probably be a good idea. Then we have the pregnancy app, which makes the journey of the pregnancy really great. And after that, we have 2 years of parenting. Now, this is based on the first 1,000 days of one's life. The foundation of all disease, disability, and personality are laid in this 1,000 days. After that, it's going to be very, very difficult to change. You can change, but it's not going to be that easy. So if we lay the foundation well, I think the outcomes are also going to be very, very good. So after this management of the first and the second and the third trimester, with all the screening, I'm not going to go into the details. It's really important that we go ahead and then deliver these patients well. So the timing also has to be really right, and that timing can only be decided by taking a good history, good follow-up of these patients, looking at all the comorbidities and whatever they have. And of course, color Doppler and fetal monitoring definitely helps us in taking a decision as far as the timing is concerned. So I'd like to really conclude here and say that yes, advanced age pregnancies are possible. Wherever required, you can please go ahead and assist, but a good counseling, a good preparation and optimizing of all the parameters, if possible, would probably help us in, delivering what we really need to deliver. Now, the picture which I've purposely put this picture for you, this is a 70-year-old who has delivered. Long time back, it's no more allowed, no more legal in our country. So it's not really nice to do what is possible always. A rational thinking is also very important, because it's not only the parents, because a lot of these parents say, bas ek baar bacha ho jaye. But who's going to nurture that child? We don't have a social security system. So we have to understand that all those pros and cons have to be understood and have to be made understood to the couple before we even venture into such a initiative. Thank you so much for having me.
Thank you, Dr.